So reading part A has 4 text. Now, as you can see, this is text A, and there will be a title. So here the title is Assessing a Diabetic Foot Ulcer. And below that, there are certain subheadings. In this case, a table over here. Okay, so we'll be discussing about part A text later on. And this is text B. Okay, so here also there is one main title, Applying Dressings for Diabetic Foot Ulcers. Okay, so again, we will be coming into the comprehension and strategies later on. Text C is called debridement of DFUs. Debridement basically means tissue removal. So now you need to understand that anyone with very good English will not pass the OET. Okay, even a person who's really advanced in English will not pass the OET. Only a medical professional who has the right skills will clear the OET with decent enough English language proficiency. Okay, so therefore debridement. Debridement is a medical term which means tissue removal. So you have to be quite familiar with certain medical terminologies. Okay, that will definitely help you out. All right, and then we have text D as well. So like this, we have 4 text. And as I told you, we have 20 different questions coming from these 700 words. And you need to have the skills over here. Okay, as I told you, an engineer with really good English will not pass the OET. A businessman with very good English will not pass the OET. A chess player with very good English will not pass the OET. Okay, who passes the OET? A medical professional with decent English language proficiency will pass the OET because they have the right skills. Okay, there are certain skills that a medical professional should have, and those skills are being tested by the OET. Okay, so never believe. So there are many students who believe, oh, I didn't clear the OET because my language is poor. No, students don't clear the OET because they don't have the right skills with them, and they don't have the right strategies with them, and they don't have the right methodologies with them. They don't know how to approach an OET question paper. Right. So let's talk about certain essential skills in OET reading part A, which is called as the expeditious reading. So first and foremost, it is the time management skills. Okay, so if you want, you may take notes of all these things. Okay, this is very important. That is, your entire strategies is centered on how you cleverly spend the 15 minutes time. Okay, that is how you utilize the given time to you so that you're able to find the answers within 20 questions. And there are certain strategies. Okay, skills are different, strategies are different. Okay, strategies is the technique. Okay, strategies is the approach. Okay, skill is something that you develop. Skill is something that you implement these strategies and you become very good at it. That is what we call as skill, right? And the second one over here is prioritizing skills. Okay, that is, you must know what to prioritize. Okay, should you prioritize the paragraphs? So we have text A, text B, text C, and text D, right? And then we have 20 questions. And that too, we have match the following questions, we have fill in the blank questions, and we have short answer type questions. So here, the student must have the right skills to prioritize. Okay, the student must know whether they have to prioritize the questions first or they need to prioritize the paragraphs first. And if they're prioritizing the questions, they should know what type of question to prioritize. Should they prioritize the match the following questions first? Or should they give importance to the short answer type questions? Or should they give importance to the fill in the blank questions? Okay, so that understanding they need to have. Only then they'll be able to find answers within 15 minutes. See, your duty is to not find the answers. Your duty is to find the answers in a high pressure situation in limited time. Okay, that is the goal over here. So according to that, you need to bring in the skills. Then question type navigation. So as I told you, there are different types of questions and you should be able to decide which questions you need to do first. Okay, everyone has their own strengths. Everyone has their own weaknesses. So understanding your own strengths, understanding your own weaknesses, you must be able to decide, okay, I should do the massive following questions first. Once I finish my massive following questions, then I should do the short answer type questions, or I should do my fill in the blank questions. Okay, so that decision ability, okay, that is very important. If you take the wrong decision, that is, for example, if you really struggle with fill in the blank questions, and if you're doing the fill in the blank questions first, then you will not be able to find the answers within the 15-minute time limit. So that decision taking ability you should have, and accordingly you should put in the committed the effort through consistent commitment and develop the skills. Now the fourth skill that a student need is strategic handling skill. Okay, that is, see, the OET, it does not have all questions of same difficulty level. Some questions will be very easy. Some questions will be medium difficulty questions. Some questions will be very, very difficult questions, very advanced questions. Even in part A also, sometimes difficult questions can come in part B and even in part C. Now, what is a difficult question? Let me ask you, in reading part A, what exactly is a difficult question? A difficult question is not a question where the language is difficult. Okay, if the language is tough, that does not qualify it as a difficult question. A difficult question in reading is a time consuming question. You may want to write it this down. Okay, in OET reading, a difficult question is a time consuming question, which means it is a tricky question. It is not direct, it is indirect. Okay, so a lot of thinking, a lot of contemplation, a lot of repeated reading. Okay, those type of questions are tricky questions, and tricky questions are time consuming. And because it is time consuming, it is a difficult question. So when you come across, when you suddenly, so the OET people will never tell, okay, this is a difficult question. Suddenly, after two or three easy questions, suddenly what they will do, they will give you a very difficult question. Right. So you must be able to handle them. Okay. Strategically, you must be able to, okay, sometimes you may have to temporarily skip it. Okay, this is a tough question and I should not waste too much of my time over here. Let me come back to this later on. So that ability to move on from a tough question and coming back to that same question after some time, that skill you need to have. Very importantly, for all the four modules, listening, reading, writing, and speaking, you need to have emotional control skills. This, especially those who have written the OET, will know what I'm talking about. Okay, those who have not written the OET, they may not know this, but those who have written the OET before, they will be able to understand how important this is. That is staying calm and avoiding panic under time pressure. So you need to understand that here your greatest tool is your mind. Okay, this is an intellectual exam, right? So the greatest tool over here is your mind. So the calmer your mind, more thought quality you will have, more clarity you will have. Okay, more judgment skills you have. Okay, see, for example, if you are very sleepy, okay, if you are feeling very sleepy, and if I'm asking you to drive 50 kilometers without any pauses, do you think you will confidently do it even though you are a very good driver? Imagine that you are one of the best drivers, but you have not slept for 48 hours, and I'm asking you to drive just for 20 kilometers or 30 kilometers. Okay, do you think it will be a very easy thing? No, it is going to be extremely tough, because why? Driving requires judgment. Okay, you must be able to judge the opposite cars coming. Okay, the speed in which you're going, the steering, the curves, and all that. So, in order to judge clearly, you must be able to think clearly. In order to think clearly, you need to have a very calm mind. And let me tell you, negative emotions will come, self doubt will come. Okay, so criticisms will come. You will start to blame yourself if one or two difficult answers you come across. Your confidence levels will go down. Okay, the OET is designed like that. Okay, it is not simply testing your language skills. So when those negative emotions surfaces up, you must be able to withstand them and not let it affect you in a negative manner. So that steadiness you must have. And there are certain strategies as well. So even if you're a candidate who struggles in this, no problem. I'll be giving you certain strategies that will help you to withstand them, and you will be able to push yourself forward. The next skill over here is logical thinking skills. Okay, because you need to apply reasoning. Okay, so especially when it comes to synonyms and all. So when it comes to OET reading and all, the same words in the question will not be repeated in the paragraphs. There they will deliberately use a lot of synonyms, sentence modifications, okay, paraphrases and all. So you must be able to identify that, and you must be able to reason them. Okay, so that is what we call as logical thinking skills. And in the case of reading part B, in the case of reading part B and reading part C, we have multiple choice questions. Okay, so there you must be able to eliminate the incorrect answer options through this reasoning skill. Logical. Logical means practical, rational. Okay, and that comes from having a very good thought clarity. Right. Now let's talk about the last skill over the few other skills over here. This is very, very important, especially for reading part A. It is called intuitive trust skill. That is trusting your own intuitions. See, all of you over here, you're all medical professionals, right? Doctors and nurses and all, right? And this exam has been designed for medical professionals. Okay, as I told you, why does a person who is really good in English but not a medical professional struggle to pass the OET? Because they are not equipped with the skills. Okay, so over here you have to trust your medical judgment. Okay, you completed your medical training, you have job work experiences as well. Okay, even if it is just 1 year also, you have some medical experience, you have done a lot of a medical education also, right? So when you come across a medical topic, okay, when you come across a healthcare topic, you will be able to connect with it. Okay, you will be able to relate with it. So certain questions, okay, your language is important, but at the same time, you will have a sense. Okay, your intuition will tell you the answer is located here. The answer is located here. Okay, so that intuitive skill you need to have. Okay, and this is very, very important for reading part A. Okay, that is called intuitive trust skill. Next one is synonym recognition skill. Okay, so this is a little bit similar. That is, as I told you, when it comes to reading or listening, they will never give you the same words. Okay, they will use a lot of sentence modifications and sentence changes. So you must be able to understand, okay, this is the word that they are utilizing. So synonym recognition. That is, some students, what they do is they scan for the same words in the question. They read a question and they will try to scan for the same words in the paragraph. And when they don't find the same word, so for example, they're looking for a word maybe like elevated blood pressure. Okay, elevated blood pressure is what is given in the question. So they are looking for the same words in the paragraphs, but they're not able to find anywhere. But in the paragraph, they might have written hypertension. Now, what is hypertension? Elevated blood pressure. Right. So a student who has synonym recognition skill will not struggle over here. And then we have comprehension skill. Comprehension basically means understanding. Okay. So what is your duty here? Your duty is to not understand the paragraphs. Okay. Your duty is to not understand the paragraphs. Your duty over here is to understand the question, understand what the question is asking you, and find the answer. So that comprehension skill, identifying what the question is asking you, registering that into your mind, and then trying to pinpoint the answer, that skill is very important. It's called, we call as comprehension skill. Right. And the last two over here, very important, focus and concentration skills. Okay, focusing abilities. As I told you, every single second matters. Every single second. For 1 second, if we become distracted, if we lose our concentration, then that 1 second is a very precious loss. Okay, so and I told you this is not very easy because OT is a very lengthy exam. See, how long is the OET reading test? It is 60 minutes. And before this 60-minute exam, you're completing listening part A, listening part B, and listening part C. And listening is a very, very dangerous exam. It takes a lot of your mental stamina, depletes you of your mental energy, right? So by the time you reach reading part A, B, and C, you're already exhausted. Okay, you may be a very good candidate, but you don't have the energy, right? And because of that, you will have less focus and less concentration, but still you must be able to sustain your concentration skills, and we have certain strategies for doing that. And finally, accuracy under pressure. Okay, so you're doing this under a very high pressure situation, so you must be able to minimize errors just in the strict time limit. Okay, maintaining accuracy even though you're in a high pressure situation. Okay, so these are the skills that you need to have if you want to get a very good score in OET reading part A. Now, let's see what are the strategies. Okay, so we talked about all the skills over here. Okay, skills is knowing, skills is something that navigates you. Okay, having the right skill will actually navigate you through the challenges. Okay, but there are certain tools. The tools are basically the strategies. Okay, so now let's talk about the right strategies that helps you develop these skills so that you get your desired OET scores. Right. So let's take an OET reading part A question paper. So OET reading part A is called expeditious reading. So which shall we take today? How about we take maybe fractures, or should we take? We'll take a paracetamol overdose. We'll take today. Right. So whatever question papers that we have shared over here, kindly remember that all of them are official OET question papers. Official OET means what? The original Cambridge University question papers. Now you see, the reason why students fail the exam, okay, there were two main reasons why students fail the exam. Is first and foremost, they don't have the skills with them. Okay, or maybe the one main reason, the one main reason why students, even though they put in a lot of hard work, okay, it's not like those who failed the OET, they didn't work hard. They worked very hard, okay, but they still failed the exam. You know why? Because they were in the wrong direction. Okay, OET is in this direction, but they prepared in this direction. So how can they clear the OET which is in this direction? So even though you're working hard, you should be able to work hard in the right direction. Now, many students, what they do is they simply develop their language skills. They study a lot of English grammar. They study a lot of English vocabulary. Okay, they focus only on the language aspect while they completely ignore the fact that OET is a game of skills. Okay, and they are not developing the skills through strategic practice, right? So when you go to fake OET materials, so if you want fake OET materials, it is very easy. Just go to YouTube, just go to Telegram, just go to other institutions also. They will very happily give you 100, 200, 300 materials. And I can guarantee you that 95% of them are going to be fake OET materials, which is only going to test your language proficiency, nothing else. It's just going to maybe improve your language, right? It is not going to improve the skills. And the skills, the question papers that assesses your skills, those question papers are only made by Cambridge Boxall Language Assessment. So Cambridge University is a British university, okay, that is responsible for making the question papers for OET. Boxall Institute is an Australian organization where the answer papers are scored, the marking is done. Okay, so if you want to get a very good score from these universities, then you must understand the exam format and exam pattern and the skills that are required to crack Cambridge University question papers. Simple as that, nothing else. So it's a very simple examination, not simple. The method of preparation, okay, the approach is very simple. It is because students get wrong guidance from other institutions, and they innocently believe, oh, this is an OET question paper, and they spend hours and hours, weeks and weeks sacrificing their jobs. But what they're doing, they are just practicing in the wrong direction. Okay, and if they're in the wrong direction, they will never clear their OET destination. Right. But students who know the Cambridge University exam and they practice only very few materials in a very limited days, but they work very smartly, they are able to clear the exam. Okay, so that is the difference between a smart candidate, okay, and an ordinary candidate. Right. So let's take a look into the OET Reading Part A question papers. Okay, so question paper. So this question paper is a Cambridge University question paper, right? And it is termed as the OET, I mean the paracetamol overdose. Okay, so let's take a look into this particular question paper over here. Just give me a second. Right. Now you see, when you get the question paper, now you see over here, they have very specifically, they have mentioned that what they have mentioned, yeah, have they mentioned, look at the foretext. What is the, no. Okay, so I can't find the instructions. Okay, so the instruction over here is that when they tell you to open the question paper, okay, that is when they give you the time, when they tell you, when they announce, okay, now you can open the question paper. That is when basically you have to open your question paper. Now, I want everyone over here to imagine that you're in the examination hall. Every one of you over here are in the examination hall, and I have distributed the question paper. The question paper is this paracetamol overdose, and I'm telling you, your time starts now. Okay, I'm telling you this. So, what you should do, don't rush yourself, don't put yourself into panic mode. Okay, because the OET will make you anxious, the OET will make you nervous. You don't make you nervous. Okay, there is no need for you to attack the question paper with full intensity. Okay, again, thought clarity comes having a very clear mind. So, you open the question paper, and the first thing that you should do is read the main title over here. So, what is the main topic over here? The main topic over here is paracetamol overdose. Okay, so you understand that. Okay, see, when you're reading something, you have to understand that because reading is comprehension. Next, what you should do is you should take a look into text A over here. Okay, this is text A, and what you have to do is there is no need for you to read the entire reading text A. Okay, now you see over here, remember the OET is not giving you marks for reading text A, B, and C and D. The OET is giving you marks for finding the answers to the questions. Very simple, right? OET is giving you scores for finding answers to the questions. So what is your priority? Paragraphs are priority or is the questions the priority? Automatically, the questions are your priority. Yes. So what you have to do, you have to prioritize the questions because your duty is to find answers to the questions. So do not spend your beginning time reading text A, text B, text C, and text D. There are more than 700 words over here. And all these 700 words are not simple English. Okay, they are not simple English over here. They are very advanced British language. Okay, so if you simply read it one single time, nothing you will understand. Okay, this is because the language is very complex. To truly understand it, you have to take your time and read it multiple times. So if a student is simply reading A, B, C, and D, they are only wasting their time and only wasting their energy. Okay, and remember, they are sitting in the examination hall in a high pressure situation. So we should, even 1 second, if you're able to save, that is very important. Okay, so what you do is you read the main title. So what's the main topic over here? Paracetamol overdose. Then what you do is you read the headings over here. Now, what is the heading over here? They have written paracetamol, contraindications and interactions. Okay, contraindications. So again, this is an medical examination. So contraindication is a medical term. Okay, so this is something that everyone must know. Contraindications basically means what? Something that is not suitable. Okay, that is in this situation, paracetamol is not suitable. So contraindicated in pregnancy. Okay, so if a woman is pregnant and they tell, if the doctor is telling this particular medication is contraindicated in pregnancy, what does that mean? That means during pregnancy, this medication should not be given. Okay, or we can say, okay, warfarin. Warfarin is a medication that is contraindicated for heart patients. That means what? Heart patients should not be, I mean, okay, so actually warfarin is actually given. But anyway, blood thinner. Okay, so as you can see over here, contraindications means it is not suitable. This particular medication should not be given to these type of patients. So situations where paracetamol must not be given. Okay, and interactions. Interactions means it can be drug-drug interactions. It can be food-drug interactions. Now, this entire text A over here will only have information regarding drug interactions, food interactions, and contraindications of paracetamol. That is where paracetamol must not be used, where paracetamol should be used with a lot of precautions. Now, see over here, we have small headings as well. Special warnings are there and precautions for use. That is, you have to be very careful when you are administering paracetamol. And then here we have interaction with other medicinal products and other forms of interaction. So paracetamol, it has the potential to interact with other medical products as well. Okay, so that information. Now you see over here, there is no need for you to read the entire text. Without reading the entire text over here, you have only spent maybe 6 seconds, 2 seconds to read these, so how many seconds do you need to read these three small headings over here? Maximum 5, 6 seconds. So within 5 to 6 seconds, you have a clear idea of what content is coming under reading part text A, right? And once you have read the headings, then you go to text B. That's it. Okay. Now what is the heading over here? Procedure for acute single overdose. Okay. Acute means sudden. That's a medical term. Okay. So if a patient is coming to the hospital with a sudden overdose of paracetamol, the patient took too much paracetamol, it happened very suddenly. So what is the treatment procedure for treating acute single overdose? That is the only thing you need to read, nothing else. Okay. So okay, reading text B is all about acute single overdose, nothing else. Right? And now how many seconds you're spending? Maybe 2 seconds, maybe 3 seconds over here. And you have a very clear idea of what information is under text B. Right? Now you go to text C. Now what is text C over here? Paracetamol poisoning, emergency treatment of poisoning. Okay, so over here there is critical. Okay, the patient's condition is very critical, very serious. So here the patient needs urgent care, the patient needs emergency care, right? So emergency treatment of paracetamol poisoning. So it is not, poisoning means what, much more than overdose. Okay, overdose means what? So for example, instead of taking 100 mg, 650 mg, if a person is taking 1200 300 mg, then that is an overdose, that is not poisoning. But over here, poisoning means like very high levels of paracetamol content in the body. So in that case, how to provide emergency treatment? That information is coming in text C. So that is also very clear. How many seconds? Maximum 5 seconds. 5 seconds for this. Maximum 2 to 3 seconds is enough for that. And then you come to text D over here. And what is the heading over here? Clinical assessment. Assessment means what? Checking, supervising, observation. Okay, so if I'm in a clinic, okay, so a patient is coming to a clinic, the patient is coming to a hospital, and the medical staff is assessing. Okay, so how the assessment is done, that information comes in text D. And history, the history of the patient. Okay, before the patient did paracetamol overdose, what were the medical history of the patient, that you can get over here. Now you see over here, text A is what? Contraindications and interactions. Text B is for procedure for acute single overdose. Text C is emergency treatment, and text D is clinical assessment. Now see, maximum 20 seconds. Okay, within 20 seconds, you have a very clear idea of what information is coming under text A, B, C, and D. On the other hand, if a student is, as soon as they open the question paper, they directly put themselves into anxiety mode. Okay, the OET is making them anxious, but no, they want to put extra anxiety on their head. So what they do, they put themselves into extra anxiety mode, and they will read the entire text. Fully they will read, nothing they will understand. That is another thing, because here it is not ordinary English. In fake OET materials, you will get very simple English, but in Cambridge University materials, the language is not going to be very simple. Those who have practiced with Cambridge University materials, they will definitely know what I'm saying. Right. So what they will do, they will spend 2.5 minutes. Okay, minimum 2 minutes they'll spend. 2 to 3 minutes they will spend reading text A, reading text B, reading text D, and reading D. They will have some memory. They will not have full memory. Yeah, some memory they will definitely have, but it is not going to truly help them. Because why? Because they spend 2 minutes. They spend 2 to 3 minutes unnecessarily. Whereas on the other hand, a smart student, within 20 to 30 seconds itself, they have a clear idea of A, B, C, and D. And from the 31st second or from the 21st second itself, they are coming to the question. Whereas on the other hand, the other student is in a very anxious mode, and after 3 minutes, okay, after 2.5 or 3 minutes only, they're coming to the very first question. Now you see over here, a smart student has just saved themselves 1.5 minutes, okay, and they are in a very calm state of mind. So who is going to perform better? The student who had this strategy, right? So this is the technique over here. Okay, so you open the main text, read the main heading topic there, understand it, then you go to the main titles of text A, B, C, and D, and you understand. Now what you have to do is, you need to understand your duty is to find maximum number of correct answers in the shortest time period possible. Yes. So what you need to do is, you need to come to the questions now. Now the question is, my question to you is, what questions should you do first? Should you do the match the following questions first? Or should you do the short answer type questions first? Or should you do the fill in the blank questions first? Okay. So my advice to you is do the questions which are the most easiest. Okay. The easy questions you do first of all. Because if you do all the easy questions first, what happens? Your confidence levels will increase. Right, because see, if within first 2 minutes or first 3 minutes, if you have 7 or 8 correct answers, how are you going to feel? You're going to feel, oh wow, I'm such a great person. Within a very short amount of time, I got so many correct answers. I'm feeling great. Yeah, this time I'm going to get maximum scores. Right? So my advice to you is you do the easy questions first. But on the other hand, if you come directly to the difficult questions, now you see, I personally believe the short answer type questions and the fill in the blank questions, they are a little bit time consuming questions. Okay, because here it is a very specific answer, and for fill in the blank questions and all, grammatical accuracy is also very important. So these are a little bit time consuming. You have to be very careful here. You have to be very specific over here. So it takes a lot of time. So if a student is coming to the difficult questions first, okay, the difficult questions, then they will find answers very slowly only. The first 2 minutes, the first 3 minutes, they will have only 3 or 4 correct answers. So what happens? The time is going in the examination hall, the time is going, and then the panic will build. Okay, oh my god, 5 minutes has gone by, 6 minutes have gone by, and I have so many questions left. So what happens to the confidence levels? The confidence levels will go down. So why unnecessarily decrease your confidence levels? Okay, so rather you come to the easy questions first. Okay, this will make you enter into a very happy state. Okay, you will be feeling much more optimistic. Okay, and you will be able to find the answers with more thought clarity. That is the first advantage. Okay, so my advice is always do the match the following questions first, because these are usually the easiest. Okay, these are usually the easiest. Now let's take a look into the very first question over here. Okay, so those who are a little bit new to the OET, your OET, what to call it? Match the following questions. Match the following questions basically means they will give you one statement over here. Now, see, they have given you a statement. So, what you need to do is you need to identify in which text this information is. Okay, so they will not repeat the same words. Okay, they will never do that. But you have to read the statement, you have to understand the information, and your duty is to find in which text, well, okay, this whether this information is coming from text A or whether this information is coming from text B, that you have to identify. And if you feel okay, the answer is coming from text B, okay, then you have to write capital letter B. Now you see over here they have very specifically mentioned you have to write capital A, capital B, capital C, or capital D. So if you believe the answer is capital B, then you write capital B over here. Right. Now, what I'm going to teach you are basically the 3 common steps or methods that comes under OET Reading Part A. So let me just type it over here so it is easy for you to understand. So the first one is called comprehension, right? Comprehension basically means what? Understanding the question. Because remember what your duty is. Your duty is to not read the text A, B, C, and D. Your duty is to find answers to the questions. Right. So comprehending the question, that is the priority over here. So for that, you need to do the keyword analysis, identifying the keywords, linking the keywords together, registering the keywords into your mind, and then looking for synonyms. Okay, that I'll teach you later on. So once you have understood the question, so once you read the question, you have to do the keyword analysis, you have to identify, you have to understand the question thoroughly. Then what you have to do is you need to retain this information to your memory. You must not forget what you read. So that is what we call as retention. So now you have a very clear memory of the question. And with that very clear memory of the question, now you need to go to the text and find the correct answer. Detect the correct answer, right? And next comes detection. Okay, so comprehension, retention, and then comes detection. That is, now you are going and trying to find where the answer is located. So here, one of the very important skills that you could have is your intuitive skills. Okay, here you have to trust your intuition. Okay, that is your instincts over here. Because why? This is a medical test. It has been designed for medical professionals, and you are all medical professionals. So you have to trust your medical judgment and your professional experience, and that definitely will help you out. This is not purely a language test, right? So let's take a look into the very first question over here. Okay. So before that, let's just take a small rewind. Let's just let me just go back to the text over here. Okay. So the headings. Okay. So I'll teach you how to trust your intuition now. So what is text A? Contraindications and interactions, special warnings, precautions, interactions with other medical products, procedure for acute single overdose, text B, emergency treatment of paracetamol poisoning, and clinical assessment and history. Okay, so this is the only thing. We have spent 20 seconds reading the headings of A, B, C, and D. And from the 21st second, or maybe the 31st second, we are directly coming to the very first question over here. Okay, now you have a head start. Other students, they will do this only after 2 or 3 minutes. But here, within the 30 seconds or 20 seconds itself, you're directly coming to the first question. Now let's do the reading of the first question over here. Now, what is the question over here? The various symptoms of patients who have taken too much paracetamol. So here, let's do the keyword analysis. The various symptoms. So they are asking you, in which text can you find the information where they talk about the different symptoms? Okay, the different symptoms of patients who have taken too much paracetamol. Now, let me ask you, do you think this information will be in text A? Now, what is text A? Text A is talking about contraindications and interactions, other medical products where paracetamol should not be given. Okay, so there is contraindications. But here, what they're asking, symptoms of patients who have taken too much paracetamol. Right. Now, what was text B? Okay, so text B was basically a procedure for acute single overdose. That is, a patient is coming with sudden overdose and how to treat this patient. Okay, now do you think, is your intuition, is your mind telling you, no, the answer is going to be here? I don't think so. Okay, because here it is acute single overdose. Now, what is text C over here? Here they're talking about treatment. That is, when a patient is having patient's critical situation is very, very critical, how to provide emergency treatment. That is the information over here. Now, do you think, is your medical judgment, is your medical professional experience telling it could be in text C? No. So here you have to trust your intuition. Clinical assessment. Clinical assessment basically means what? Checking whether, how, that is confirming. Okay, assessing means what? Supervising, observing, and confirming whether the patient has taken too much paracetamol. So during the assessment, okay, so when a patient is coming to the hospital, when the patient is coming to the clinic, we will obviously assess the patient. And when we assess the patient who has taken too much paracetamol, we will be able to see the different symptoms the patient is having. Right. So see, like this, you have to trust your intuition. So you must be able to directly come to text D. Okay, that is, your intuition is saying this is the text where the answer is most likely to be here. Right. Now what you do is, now you have trusted your intuition, you have ignored A, B, C, you have come over here. Now you need to confirm. Now you need to determine whether here they have mentioned the various symptoms of patients who have taken too much paracetamol. Right. So now what you have to do, you have to retain that. Retention is very important. You have to register that information to your mind. And now you have to scan. Okay. So now what you have to do is, you have to scan for the information that you're looking for. So here you have a very sharp focus. Okay. See, you have a very sharp focus of the question and you are reading with an aim. Right? Because what is your aim? Your aim over here is to find the various symptoms a patient is suffering who has taken too much paracetamol. That is the aim. Okay, and your memory is very sharp as well. Okay, but on the other hand, if a student is simply reading A, B, C, and D, they are not reading with an aim. They don't have an aim. They don't have a focus. So here, your aim and focus will help you to scan the information much more effectively. Now let's see over here whether we can see the various symptoms. So let's see. Commonly, patients who are taken paracetamol overdose are asymptomatic. Now see, they are asymptomatic for the first 24 hours. Asymptomatic basically means what? They will have no symptoms or just have nausea and vomiting. Now you see over here, patients who have taken a paracetamol overdose. What are the two symptoms? What are the various symptoms they will have? The first symptom is nausea and the other symptom is vomiting. So now itself, we have actually confirmed that the answer is in text D. Right now, these are certain complications. These are not, this is diagnosis, huh? Oliguria, hypoglycemia. These are not symptoms. These are names of a disease, is what we call as a diagnosis. Nausea, vomiting, and all are not diagnosis. It is a symptom. So the answer is over here. Okay, so now what you can do very confidently, you can write the answer as the capital D over here. You see, how much time did you spend for that? Just few seconds, right? You trusted your intuition. Okay, you did you read text A, B, C, and D? But without reading A, B, C, and D, you were able to trust your intuition and you were able to go to text D. And then you had a memory of the question and you were reading with an aim and you read, okay, nausea, vomiting are the symptoms of patients who have taken paracetamol overdose. So the information is coming from text D and you spent just few seconds there and you already have the correct answer. On the other hand, the other students, they are still reading text A. The other students, they are still reading text A, okay, and they have not even started text B, but you already have one correct answer. You already have one correct answer. That is the difference between a smart student who has the right strategies with them. So this is where you need the expert guidance, a person who really knows what they're teaching. Right. Now let's come to second question over here. Okay, so here also let's do the keyword analysis. Okay, so let's read the question first and then let's identify the keywords. Now, the precise levels of paracetamol in the blood which require urgent intervention. Now, you see over here the precise levels. Precise means what? Accurate. Okay, precision. Precision means accurate. So here they're talking about a specific level. Okay, the precise level of paracetamol in the blood. Okay, in the blood which require urgent intervention. Now, what is the keyword over here? Urgent intervention. Urgent intervention means what? Emergency treatment. Okay, emergency treatment for a patient who has taken paracetamol poisoning. So your intuition. So what your intuition telling? Okay, you did not read text A, B, C, and D. You only read the headings. Okay, and you're trusting your instincts over here. And now, as soon as you read this, you're able, okay, the precise levels of paracetamol in the blood which require urgent intervention. So the chances is it is very likely to be in text C because here see urgent treatment, emergency treatment. So you're directly coming to text C over here, right? And now what you need to do, you need to confirm. Now the confirmation process. So what's the question asking you? Specific levels, precise levels in the of paracetamol in the blood. Okay, now you see over here, what is the keyword they have mentioned over here? Plasma. Plasma means what? Plasma is a medical term for blood. Okay, and what is the what they have? Plasma paracetamol concentration. That means concentration level of paracetamol in the blood. See, like this, they will use synonyms. Okay, now you see over here, we have a graph. And see, what is the graph telling us? We are talking about specific levels. Okay, now see 40 mg per liter, 100 mg per liter. Okay, and we have the time, we have the time in the this is the x-axis, right? Yeah, the time in the x-axis, and in the y-axis they are talking about the blood plasma level concentrations of paracetamol, and everything is under emergency treatment. So what you have done, you have just confirmed the answer. Okay, now see here also they have written patients with plasma paracetamol concentrations above the treatment line, normal treatment line. Okay, and then we have high risk treatment. High risk treatments means what? Emergency treatment. So like this, you can just scan through. Again, you're reading with an aim, you're reading with an intent, and you're scanning through the content over here, the information here with a very solid memory of the question, and you are confirming the answer, and you are writing the answer as what? Text C. Okay, the answer is C because urgent intervention, emergency treatment is coming there. The other students, they are still reading text A. You already have two correct answers. How are you going to feel in the examination hall? You're going to feel very much confident and elevated, right? That is because you are implementing the right strategies. And these strategies you will only develop if you are practicing with the original OET materials. If you are practicing OET with the fake OET materials, these strategies and these skills will never, you will never be able to develop. So be smart in the materials you choose. That is extremely important. Now let's take a look into the third question over here. So what's the third question over here? The third question is the steps to be taken when treating a paracetamol overdose patient. Now here, the steps. Steps means what? Step number one, step number two, step number three, step number four. A process. Okay. And what is the process over here for treating a paracetamol overdose? Now see, in text C, it was urgent treatment. And they're talking about plasma concentration levels. But what did we read in text B? Now see, text B was procedure. Procedure means what? Steps. Procedure number 1, 2, 3, 4, 5. Steps. Step number 1, 2, 3, 4, 5. Okay. And see what is the acute single overdose. Acute single overdose means what? Sudden overdose of paracetamol. Okay. So if a patient is coming over here, step number 1. What is step number 1? Establish time since ingestion. Step number 1 is confirm. Establish means confirm. Okay. Since ingestion, that is how long ago the patient took the paracetamol overdose. That you need to confirm. That is step number 1. And what is step number 2? Okay. Now see, if the patient took, so this is what we call as a flow chart. Okay. So this diagram you see over here, this is a flow chart. And again, as a medical professional, when you are studying your medical degree, I'm pretty sure you might have come across so many flowcharts. That is why your medical profession, your medical background is important here. Okay. So see, if it is less than 4 hours, then the staff should do these steps. If the patient took the paracetamol between 4 to 8 hours ago, then they should do these steps. If the patient took between 8 to 24 hours, these steps they have to do. More than 24 hours, more than 24 hours means they have to do these steps. So now see, no need for you to read everything, but you're just confirming the correct answer. And what is the last step over here? Patient needs treatment. Then you need to determine whether the patient needs treatment with acetylcysteine. So if the patient does not need treatment with acetylcysteine, this is the next step, the last step over here. And this is the last step over here. Who is Jesse Sana? All right. Okay, so let's see. So what will be the answer over here? What will be the answer to the third question? The third question will be text B. Now, how you found the answer? Simply by reading the headings. Now, see, did you read the entire A, B, C, and D? No. You just spend a few seconds reading the titles over here. Okay, and you're trusting your intuition and you're comprehending the question. You're prioritizing the question. Okay, and you are giving importance and you are going there. Now, see, sometimes your intuition may be wrong. Sometimes your mind will tell you the answer is in text A. Okay, so no problem. Then that is why the confirmation process is important. So now you read text A and you see whether it is mentioned here or not. And if it is not mentioned, no problem. That means your intuition was wrong. Okay, no problem. Then you go to the next, the second, likely with the text where it is going to be there most likely. Then you go there and you see whether you confirm the answer is there or not. Now you see the other students, now they are reading maybe text B. Okay, they have not yet started the answer, but you are now going to attempt the fourth answer. Okay, now you are going to attempt the fourth question. They are still reading text B. Now this is the difference. There's a difference between a student who knows how to approach the OET, how to think very smart and how to develop the right skills and how to think very clearly and how to navigate the high pressure exam situation. Right. So now let's maybe do the seventh question over here. Okay, maybe the sixth and seventh we will do. So let's read the sixth question over here. So what's the sixth question telling us? The sixth question is telling us what to do if there are no details available about the time of overdose. Now, what's it the question over here? What they're asking you, what to do? That means what step should you do? What step should you take if no details are available about the time of overdose? So what is the keyword over here? Time. Okay, so we don't know when the patient took the paracetamol overdose. And in that case, what you should do. So what is your intuition telling? Do you think the intuition will be in clinical assessment? Or do you think it is going to be in emergency treatment? Or do you think it is going to be in contraindications? No. Your mind will tell you, okay, we saw a flow chart, right? We saw a flow chart. And what did we see over here? See, unable to establish. Now see over here, Establish time. Now, what is the keyword over here? Establish time since injection. So this is the keyword. So your intuition should tell you, okay, this is where the answer is. And now what's the question telling you? We don't know the time. What should we do if we don't know when the patient took the overdose? So see whether it has been greater than 24 hours or we are not able to establish when the patient took the overdose. So in that situation, what should you do? You must start acetylcysteine. Okay, you should check paracetamol level and you must measure the AST and ALT levels. Okay, and then if paracetamol level is more than this, then continue acetylcysteine. Now, these are the steps you need to do. Okay, so what will be the answer to that? The answer to that will be text the B option. Now, let's do the seventh question over here. So, what's the seventh question over here? Dealing with paracetamol overdose who have not received adequate nutrition. Okay, so over here we are talking about dealing with paracetamol overdose. Okay, paracetamol overdose patients who have not received adequate nutrition. Okay, that is they are malnourished. Okay, the patient is malnourished. Okay, they have not taken much nutrition. Okay, and at the same time they are paracetamol overdose patients. So when we come across those type of patients, how should we deal with them? Okay, so the answer is going to be either in text B or text C. Okay, so what is text B? Text B is dealing with a patient who has taken overdose. Now you need to confirm. Okay, so let's say that your intuition is telling that it is in text B. Okay, but now you need to look for the keywords malnourished, not having taken too much nutrition over here. Now, as you can see, we don't have any information regarding the nutrition aspect. That is what we should do when a patient is malnourished and whether he has taken paracetamol overdose. Okay, so like this, you should be able to scan for the keywords. Okay, so here you must be able to see there is nothing related to the nutrition. Okay, so here they have written serum electrolytes they have mentioned, but over here they are not saying that the patient is malnourished. So let's see, we have another text which is also related to treatment over here, right? And see over here we have some information over here. So let's see whether some word is related to nutrition. That is how to deal with a patient who has not taken enough nutrition. Now, see, when you're scanning for that in this information, you can see the word malnourished. Patients on enzyme-inducing drugs, example carbamazepine, phenobarbital, phenytoin, primidone, rifampicin, and St. John's wort, or who are malnourished. Okay, so patients who have taken these medications, okay, who are taking these type of enzyme-inducing drugs, or those who are malnourished. Example, anorexia. Anorexia means what? People who have an eating disorder. Anorexia is an eating disorder where people don't consume much food. They stay away from food, or in alcoholism. Okay, or those who are HIV positives. How should we deal with them? We should deal with acetylcysteine if the plasma concentration levels above high risk line. That is, we should treat these patients as if they are high risk patients. Okay, even though they are not high risk patients, even though they are not actual high risk patients, if a patient is taking these medicines, if a patient is malnourished, okay, if the patient is anorexic, alcoholic, or HIV positive, then we should be treated with acetylcysteine, okay, if their plasma concentration is above the high risk treatment line. Okay, so like that, what is the answer over here? Again, the keyword is over here, right? So the answer is going to be text C. So like this, what you have to do, you sometimes your intuition may be wrong. Okay, so you may directly go to text B, but you have to now do the confirmation process. So after the confirmation process also, if you're not able to find the answer, then you go to the next text where you believe the answer is most likely to be. And then you confirm the answer and you write it down. Now you see over here, by the time the other students come to the very first question, you already have found answers to all the 7 questions. They are beginning with the very first question. You already have found answers to 7 questions, and now you are going to the 8th question. Now, what is the difference between your reading and their reading? Now, see over here, those students who read text A, B, C, and D, they are not reading with an aim. You need to understand that they don't have an aim in their mind. They don't have a focus. They're simply reading it. It is aimless reading. But how did you read? you had the memory of the question. Okay, you have a very solid memory of the question. And with that memory, with an aim, with a focus, you are reading the information here. Yes or no? Okay, so so when you are reading the text A, B, C, and D to find answers to these questions, you will have a very, very stronger memory than other students. Okay, because you read with an aim. You do not read full A, B, C, and D. You only read few parts of it, but still you will have a much more clearer memory of the information coming from A, B, C, and D. Right. So when you come to the eighth question, that is once you finish the first seven questions, and once you come to the eighth question, you know the second advantage is, first advantage is your confidence levels is very, very up because you're feeling very great. You have found the answers to the easy questions in a very short time. You know, the second advantage is you have familiarity. Okay, you have established familiarity with the information coming from text A, B, C, and D. That is your advantage over here. So when you're reading the eighth question, okay, you will again your intuition will help you, but at the same time that memory, okay, that memory of having read the A, B, C, and D in detail, I mean with focus, that familiarity will help you here as well. So here you will be able to find the answers much more quickly. You will be able to find the answers much more quickly than the other students who read A, B, C, and D without any aim, where they did aimless reading. So that is the second benefit over here. Okay, so now let's just do random questions from short answer questions and some random questions from the fill in the blank questions. Okay, so what's the eighth question over here? The eighth question over here is, if paracetamol is used as a long-time painkiller, what symptom may get worse? Okay, now see, the question is asking if paracetamol is used as a long-term painkiller, that is for the patient is having pain, okay, long-term, chronically, okay, so 2 months, 3 months, 4 months, 5 months, continuously, the patient is using paracetamol as a painkiller, okay. In that situation, what symptom may get worse? So what is the question asking you? The patient will have some symptoms, but that symptom will get worse. What symptom will get worse if a patient is taking paracetamol as a long-term painkiller? Now you tell me, what is your intuition telling you? Is it going to be in text A, B, C, or D? Okay, so let's see. So let's take a look into text C over here. Now, what is text C? Emergency treatment of poisoning. Okay, emergency treatment. So what's the question asking you? Chronic usage of paracetamol as a painkiller. Do you think that information will be here? Not likely, right? And also you have read, okay, so to find the previous questions, you have read a little bit of text C as well. So you can say no, that information is not going to be here because you're already familiar with the content. What about text B? Do you think it is going to be here? Text B is what? Procedure for acute single overdose. Do you think your intuition will tell you, chronic usage of paracetamol as a painkiller, symptom will get worse? Do you think that information is going to be here? Not likely. So B and C you will ignore. So the highly other two likely paragraphs is either A or either D. Okay. Now what is A over here? A, precautions. Cautions means what? Warnings. Okay. Now see, they're asking a warning, right? That is, if you use paracetamol as a painkiller for an extended period of time, one symptom will get worse. So you have to be cautious. You have to be warning. So what is your intuition telling you? Your intuition telling, this information is most likely to be in text A. So you will be able to come to text A. Okay. And again, you have read A, B, C, and a little bit also. So you'll be able to come over here. Now what you have to do, you have to, again, comprehension. Comprehension means understanding the question. Retention. Retention means having the memory of the question to your mind. What symptom will get worse if used as a long-term painkiller? Okay. Now let's see whether that information is mentioned over here. Now see over here, they have written, where analgesics are used long term, see, the first keyword is coming. Okay. Analgesic means painkillers, right? Painkillers used as long term for more than 3 months with administration every 2 days or more frequently. Okay, every 2 days means every 2 days, okay, or frequently or more frequently. Headache may develop or increase. Now you see, increase. What will increase over here? Headache. Headache may become increased. What's the question asking you? Which symptom will become worse? So if a headache is becoming increased means what? Headache as a symptom will become worse. So what will be the answer to the eighth question? The answer to the eighth question will be headache, right? Now see, this is why I told you these questions are time consuming questions because these questions are very specific. The answer is it's a very specific location. First paragraph, second sentence, or last word. Like that, a very specific location is there, and you have to hunt for the answer. And now see, synonyms they are using. Increase, instead of using the word worse, now see in the question, what is the synonym here? In the question, the synonym is the word keyword is worse. But in the paragraph, they have used the word increase. Right. So that's why I told you these questions are time consuming. So if a student is directly coming to these questions, they will enter into panic mode because they will not be able to find the answers more easily. Okay. And they will spend a lot of time. And the more time they spend without finding the answer, the more nervous they will become. Thought clarity will go down and they will struggle. So that's why doing the easy questions first is much more preferable. Right. So now let's take a look into the how about the ninth question over here? What was the ninth question? It may be dangerous to administer paracetamol to a patient with which viral condition? Now see over here, they're asking it may be dangerous. Means it is a very dangerous situation if we are administering paracetamol. Okay, that is, you're giving paracetamol to a patient with a viral condition. So what is the answer? So a patient suffering from a viral condition, if we are giving paracetamol, then it is going to be a dangerous situation. Which viral condition? So here also, where do you think the answer will be? Do you think the answer will be in clinical assessment? Do you think the answer will be in history? No. Do you think it is going to be in emergent treatment? No. Do you think it is going to be in the procedure? No. It is going to be in the warnings. Okay. Contraindications, interactions. Okay. In which viral condition? Okay. In which viral condition, if we are giving paracetamol, okay, it is going to be a dangerous situation. So a warning. So you will be directly coming to text A. Okay, so now you have to hunt for the answer. Now you have to keep the memory of the question to your mind and you need to detect the answer. Viral condition. In which viral condition should you not give paracetamol overdose? Now see over here, care is advised in the administration of paracetamol to patients with alcohol dependency, severe renal or severe hepatic impairment. Impairment means what? Damage. Other contraindications are shock. That means if a patient is suffering from shock, patient is suffering from acute inflammation of liver due to hepatitis C virus. Okay, the hazards of overdose are the hazards. Hazards means what? Dangerous. Okay, that it is a very dangerous, okay, situation. Now, what is the question asking you? Virus. Okay, so if a patient has been infected with hepatitis C virus, we must not give them paracetamol because why? It becomes a dangerous situation. Now, this is a tricky question. Now, what will be the answer? You have, so here they have written hepatitis C virus, right? Okay, so you come to text D, the ninth question over here, and let me tell you, if you write the answer as hepatitis C virus, you will be losing marks. So can you tell me why, if we write hepatitis C virus, we will be losing marks? Now, this is where the brilliance of OET comes. This is where how cunning OET is, and this is where how sharp your observation skill must be. See, give importance to the question. What is the question asking you? In which viral condition? Condition means what? A disease condition. So when you write hepatitis C, that is a disease condition. Yes or no? Hepatitis C, if you're writing, that is a disease condition. But if you write the word virus here, if you write the word virus here, then it is not a disease condition, because hepatitis C virus is a name of a virus. Is the question asking you the name of a virus? No. The question is asking you the name of which viral condition. So here you must not write hepatitis C virus. You must write only hepatitis C. Okay. So the virus you should be able to eliminate. So that intelligence, that sharpness you must have. So if a student is able to write hepatitis C only, they'll be getting full marks. On the other hand, if a student is writing hepatitis C virus, then they will be getting less marks. They'll be getting some marks, but not full marks. Now, this is where, now see, if a student is in panic mode, if a student is in anxiety mode, okay, so not thinking clearly, do you think they will be able to write only hepatitis C? No. That's why there are a lot of traps in OET. There are a lot of tricks, trickery. The OET is a very trickster, and you have to navigate through them very, very cleverly. For that, you need to think with logical brain, and there should be a lot of clarity in the way you navigate your exams. That is the skill. See, a medical professional should treat a patient even in high pressure situation with a lot of clarity. Imagine that you are a patient and the doctor who's treating you is nervous. Imagine that you're a patient, the doctor is treating you, the nurse is treating you, the nurse is nervous, the doctor is nervous. Would you be confident in that, in their presence? No. On the other hand, if you are in a very high emergency situation, but the person who's treating you, they are very calm, they are thinking very logical, you will feel safe in their presence. So that is the skill that a medical professional should have. And the OET is not assessing whether you know English. Now, this is what you need to understand. The OET is not assessing whether you know English or not. The OET is assessing whether you have the right skills that a medical professional has. That is thinking very logically. So that skill, so you need to develop those skills to get your desired OET scores. Right. And you have to do everything within the stipulated time. So let's do one or two fill in the blank questions, and then we'll wind up the session. Now, see, when we are talking about fill in the blank questions, here your grammatical accuracy is important. Okay, because sometimes it may be plural here. Okay, the question may be plural here or maybe singular here, but in the text it may be plural or it may be singular. Okay, so you have to read the sentence. You have to read the sentence. You have to understand the grammar. So you have accordingly you have to adjust. So maybe in the text it may be singular tense, but maybe here you may need to convert that into plural tense. Okay, so that or sometimes it may be present tense in the text. Okay, maybe you need to convert that into past tense over here. So that small grammatical range is also a little bit necessary. Not always, but most times necessary in fill in the blank questions. And that is why fill in the blank questions are also slightly tough. It is time consuming. Okay, so therefore, don't directly come to these questions because you will be unnecessarily sacrificing the easy questions. Right. So let's read the 14th question over here. What's the 14th question asking you? If a patient has taken metoclopramide alongside paracetamol, this may affect dash of the paracetamol. Okay. So now what I'm going to, so these are the keywords over here. Okay. Now, along with keywords, there are certain words which we call as the linking words. Okay, linking words basically means the words that are closely related to the blank over here. So what's the word over here? Affect. Okay, and paracetamol. So affect and paracetamol are keywords, but at the same time, they are linking words as well because they are both linked to the missing information. Right. So what is the question asking you? If a patient has taken metoclopramide with paracetamol, so the patient has taken combination of paracetamol and metoclopramide, so there is a drug interaction. Okay, now there is a drug interaction, and because of this drug interaction, something of the paracetamol, okay, something of the paracetamol drug will become affected. Okay, so what becomes affected? Okay, what becomes affected? Something of paracetamol becomes affected. What becomes affected? That is what you need to find. Okay, so now you have to retain this information to your memory. Comprehension you have done. Now you have to register this information. Okay, you have to register this information to your memory. Now what you need to do? Now you need to trust your intuition. Now, where do you think the answer is going to be? Drug interaction. Okay, metoclopramide, paracetamol. Do you think the answer is going to be in here? Assessment. Do you think the answer is going to be in emergency treatment? Do you think the answer is going to be in procedure for single acute overdose, or do you think the answer is going to be in interactions over here? Now see, the heading as I have mentioned, interactions. So here the answer is most likely to be here. Now what are the keywords? Metoclopramide. Metoclopramide in combination with paracetamol, something of the paracetamol may become affected. What becomes affected? Now see, now you scan. Now there is no need for you to read where analgesics are used long term with administration. Like this, there is no need for you to read. Your duty is to not read the paragraphs. Your duty is to find the answer to the question. Metoclopramide. That is the only word that should be in your mind. So scan for the word metoclopramide. So where do you see? Immediately you'll be able to spot over here. Directly come over here. Now see, what have they written? See, interactions. Paracetamol with metoclopramide. If this combination is taken, it may increase, metoclopramide may increase the speed of absorption of paracetamol. So what happens when paracetamol is taken along with metoclopramide? Metoclopramide will increase the speed of absorption. So see, when we take a medication, it goes to our stomach, right? And then from the stomach, it becomes absorbed, right? So gastric absorption and all is, and then it goes to the liver for metabolism and all. So there is a specific time for it. But if you're taking metoclopramide, then very rapidly, it will be absorbed by the human body. Okay, so that is what becomes affected. So what becomes affected? Okay, the speed of absorption will become affected as it increases. Metoclopramide increases the speed of absorption. This is affected. Okay, so what will you write? Okay, now when you come over here, now this is the fill in the blank question, right? Now, what will you write? Will you write increases speed of absorption? Can we write this? Now see, you have found the answer, you have understood the question. Okay, you have retained the keywords in your memory, and with a lot of effort, you located the answer and even found the answer, and now you're writing it down. And exactly what you saw there, you're writing. Okay, now what are you writing? You're writing increases the speed of absorption, because that is exactly what we saw there. Now you read the entire sentence together. If a patient has taken metoclopramide alongside paracetamol, this may affect the increases speed of absorption of the paracetamol. Now, do you think because of this word over here, it is a grammatically accurate sentence? But if we remove this word, now you read, if a patient has taken metoclopramide alongside paracetamol, this may affect the speed of absorption of the paracetamol. Now, if you have written speed of absorption, you will be getting full marks, because you have proven that you have good range of grammatical understanding. But if a student writes, okay, increases, then that student will not be getting full marks. This is the difference. So see, that much clarity and keen observation skill you need to have. Okay, so this is how you have to approach the reading part A question paper. Okay, so let's just do one more question over here, and then we will just wind the session up, right? Okay, so how about, okay, this is a tricky one. Okay, so this is a tricky one. Okay, so the 18th question. Okay, so let's do the 18th question. This is a tough one. Huh? This is a tough one. Many students get this wrong. Read the question very carefully. A non-high risk patient. What type of patient? A non-high risk patient. That means a patient who is not high risk. Not high risk means what? An normal patient. See, if they want, they can write. The OET people can write a normal patient. But instead of writing normal patient, they have written a non-high risk patient. Again, expected, they are very cunning. Okay. So as a medical professional, you must have that keen observation skill. That's whether you have that skill or not, that is being tested. Not knowing whether you know English or not. That is not important for OET. Okay. So a non-high risk patient should be treated for paracetamol poisoning. Okay. If their paracetamol level is above dash mg per liter 8 hours after overdosing. Okay. Now see, what are the linking words over here? What are the linking words? The first linking word over here is level, paracetamol level above. Okay, so the level is above this much. And what is the other linking word over here? Milligram per liter, that is the unit. And 8 hours, 8 hours after overdosing. So these are the linking words over here. Okay, so now you understand the question. A normal patient, okay, paracetamol poisoning. And the question is asking you, what is their, okay, if their paracetamol level, okay, their paracetamol level should be above this level after 8 hours. Okay, so they have taken overdose, they have taken paracetamol overdose. It has been 8 hours. Okay, and after 8 hours, what should be their plasma concentration level? In their blood, what should be the paracetamol level? That is what they're asking. Okay, now you understand over here. Now, this is a tricky question. Okay, so if you want, once more you read the question, because now I'm going to the text. A non-high risk patient should be treated for paracetamol poisoning if their paracetamol level is above how much mg per liter 8 hours after overdosing. So obviously we know that the answer is going to be in this graph over here. Okay, now see, in this graph we see high risk patient. Okay, now you see this curve over here. This curve over here is dedicated only for high risk patients. But what is the question asking us? A non-high risk patient. So we know that this is what they're asking. Now see, the OET is very cunning. So this is the graph, the curve they're asking. Okay, now they have given us 8. Okay, so now in the time over here in the x-axis, 8 they have mentioned, 8 hours. Okay, so we have 8 hours over here. Okay, and now we know this is the graph that we're looking for. So now what you need to do is you need to correlate. Okay, so from 8 you need to go and not come to this curve over here. You need to come to this curve because this is the curve that we are looking for. Okay, and the question is asking you what? Okay, if it has been 8 hours after overdose and if it is a non-high risk patient, okay, how much should their paracetamol plasma concentration level be? So where is it amounting to? It is amounting to 100, right? So what will be the answer? You will be writing 100. Yes or no? Okay, so the answer will be 100 mg per liter. So don't write 100 mg over here. Okay, because we already mg per liter is mentioned over here. So only write 100. Now if you're writing mg per liter, now you read the sentence. Paracetamol level is above 100 mg per liter. Again 100 mg per liter is coming. So that is a grammatically inaccurate sentence. 100. If you're writing only 100, you'll be getting the correct answer. Okay, that's a tough question over here. So like this, you must be able to do the what? Reading part A questions. Okay, understood. So this is the best approach. So let's have a small recap of the strategies over here. Okay, so when you get your reading part A, understand that this is called expeditious reading. Okay, that is you're supposed to find the answers in the shortest time period possible. Okay, and you need to have the right skills with you and you need to be able to think clearly. So when you get your question paper, do not read A, B, C, and D. Only read the headings over here. Okay, so see, main topic, paracetamol overdose, that you read. Then read the headings, paracetamol, contraindications, interaction. Like this, you read the titles or the headings over here. Understand procedure for acute single overdose, emergency treatment, clinical assessment, history, right? And next you come to the the match the following questions first, because these are not time consuming. These are a little bit more approachable, a little bit more easy. So your goal is to improve your confidence levels. You need to improve your confidence levels. Yes. Okay. And you also need to get maximum number of correct answers in the shortest time period possible. So you do the match the following questions first. So understand the keywords, comprehend the question, retain the memory of the question to your mind. Then you go to the paragraph and then you determine where the answer is. And you have to trust your intuition. Okay, it is a game of intuition. Trust your intuition. And next you come to the short answer type questions. Okay, and next you come to the fill the blank questions, and you will come across very difficult questions as well. Okay, though it is very tricky once in a while, maybe maybe the first question itself, maybe the first question over here will be a very, very difficult question. So if it's a difficult question, temporarily skip it. Okay, don't waste too much time. Never be a stubborn student. Oh, unless and until I find the answer to this question, I'm not going to find any question. So don't be that type of student. If you can't find the answer, then you temporarily skip it and you go to the next question. Okay. And then towards the end, you come to the difficult questions. Right. So this is the right strategies on how we should approach an OET reading part A. Right.